A drooping eyelid makes you look older, gives your face a more tired appearance, and honestly, it doesn't look very appealing. And a lot of people think there's nothing you can do about it. They believe that if you have it, the only solution is dangerous blepharoplasty to get rid of it. But today, in this video, I'll talk about all the reasons why drooping eyelids occur and share an exercise to help you deal with it. But before we get started, please check if you've subscribed, because it really helps my videos get promoted on YouTube. You know, I also had a drooping eyelid when I was a kid. And even now, you can see that my upper eyelids are pretty heavy. I've had this issue since childhood. Actually, I wouldn't even call it a problem. It's just a genetic fact. People, especially those of Asian descent, tend to have narrower eyes and heavier upper eyelids. I actually inherited something from the Asian race too, so my eyes are a bit narrower. What's most interesting is that over time, of course, I've worked on my face, and I noticed as a side effect that my eyes started to open up more, my eyelids lifted. Because even if you have a genetic predisposition, even if you've had heavy upper eyelids since childhood, with techniques for working on the skull and stagnant fluids, you can open them up a bit and make your eyes look more open. Of course, there will be a limit to how much you can improve, but in any situation, you can make things better. And for those who noticed that you had beautiful, open eyes since childhood, but then something happened and they became more closed. If your gaze has become heavy, then that means you have a deformation type even more so. And due to changes in the skull, tissue swelling, and facial muscle tension, the eyelids started to droop. You especially need to work on this problem, and you can bring the situation back to normal. In most cases, if you practice regularly. And now I will show you the techniques, and now I will show you the first technique. We will be stimulating the lymph flow. If we look at the problem of a drooping eyelid, this little bulge here contains a lot of fluid, because there's actually a small pouch here where fluid accumulates. Why does fluid accumulate there? Of course, there are many different things that need to be addressed. Ideally, you should work holistically with your whole body. That's what I teach on my program. Because your posture, neck, and skull all affect the drainage from your face. And especially when you wake up in the morning, you notice that your eyelids are puffier. This is due to chronic swelling. So now I'll show you a technique you can use. So first of all, you need to regularly do lymphatic drainage with your fingers. That is, lymphatic drainage works like this: all the fluid from your face moves towards your ears and then down your neck. So with your fingers, you start smoothing and pressing all the fluid out toward your temples and then down. Just do this about 30 times, more or less, okay? Keep doing it, do it 30 times. You can do this over your whole face, about 30 times each area, and then move on to the eyelid. So, here's your eyebrow. You grab your eyebrow and start gently kneading it like this. You can even use your lower finger to go along the eyebrow and the drooping eyelid like this, and you're removing all the fluid that's built up here. Since I'm an osteopathic doctor and work holistically, I want to say that if you don't address the deeper causes, which I teach about in my academy, you won't be able to eliminate the root problem, and the fluid will keep accumulating here. You'll just need to do the massage every day. If you are able to eliminate the causes, then the fluid simply won't accumulate here. If you already have a noticeable buildup of fluid, then you should do this kind of massage. And then go over the forehead again and down. And do this at least 30 times. In the mornings, especially if you feel your face is swollen, you do it like this. What's next? What else can you do? Let's move on to the second problem, which is related to muscle spasm. Because if we look around the eye, right here is the circular eye muscle. It's like a sphincter. But when you squint, it contracts. So what happens when it contracts, right? If it's in a heightened spasm, the eyebrows start to drop down. So this whole area starts to get squeezed. See, there's a difference, right? Or when the muscle is relaxed. So, is this connected to the muscle? So if you squint, if you often concentrate, if you experience certain emotions, especially negative ones, yeah, that leads to the muscle tensing up. And what do you need to do? There's a simple solution. What can you do? You can place your hands on your eyebrows and lift your eyebrows. Just start raising your eyebrows. And notice that right after this, your eyebrows will immediately start to rise. So you lift your eyebrows up and start squinting. Squint for 5 seconds. Then take a breath in and out. And then do a light vibration upward. Okay, great. And do this 5 times, at least, right? Once again, raise your eyebrows and start squinting. Squint for 5 seconds, then inhale and exhale. And do this kind of vibration, lifting your eyebrows up. So this technique allows you to relax, and you'll notice that your brows and eyes start to open up. The third reason. So, you need to work with the muscles. And basically, I teach how to work with all the facial muscles, because every muscle matters and can cause different problems. Right. And the third layer, an even deeper layer, is the skull. As we age, our face and skull change, and the skull ages too, especially if you don't pay attention to your posture or take care of your skull, which also absorbs both physical and emotional tension. Because, essentially, bones are just like ligaments, only they're calcified. And considering the fact that connective tissue itself, fascia, acts as a kind of semiconductor, that is, it transmits nerve impulses, electricity, tension and blockages can accumulate in it, and collagen itself has the ability to contract, which is why the face starts to tighten and deform. The skull can also contract and deform with age. This can lead to asymmetries. And the very first thing you might notice is that with age, if your face and neck were more elongated in childhood, your head becomes rounder and wider. And the eye sockets too. In other words, everything starts to press in. Especially the frontal bone, when it's tense, it creates pressure on the eyelid and also disrupts circulation, causing swelling. That's why working with the bones of the skull plays a key role in improving appearance. Because when we work with lymph or with muscles, we have certain limits. If you work with the bones of the skull, you can further enhance the results with a variety of techniques. I actually teach how to work with the skull and osteopathic techniques on my faceplasty program. And it's precisely these exercises for working with the skull that deliver the best results. So if you want to look 5 or even 10 years younger, want to tighten your face, lift droopy eyelids, then join my rejuvenation program. You just need to go to the link in my description box and start your journey of youth. By the way, I want to point out that right in this area, where the drooping eyelid is, that's where the lacrimal gland is located, and any glandular tissue responds to any stress, tension, or emotions with swelling. And that's why, when you work with the muscles, especially with the skull bones, with the frontal bone, the lacrimal gland is located right under the frontal bone, you can reduce the swelling, and then the eyelid will lift and your eyes will open up. Friends, I record a lot of useful content for you from the bottom of my heart, and I do it with great pleasure. And my large team edits these videos so that they are as concise, brief, and useful for you as possible. Please subscribe to the channel and be sure to like the videos, because it helps them get promoted on YouTube. This was Dr. Alesh with you, and I'll see you in the next episodes.